The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. I am Tony Urbanic, and we are gathered for the next episode of TMD Demystified. Today, we're going to continue the two-part series that I began last week on why dentists, you, the person now listening to this, should desire to treat TMD or not treat TMD. The first episode last week was devoted to why dentists don't want to treat TMD. And hopefully I knocked down, dissuaded, got you to understand that there really are no good reasons not to treat TMD. But the justifications and the reasons that you most likely would throw out don't hold water. It's really not justified. But today we're going to be most specific on why you should, and specifically why you should want to treat TMD with our device, better known as the Urbanic device. Again, I had to call it the Urbanic device because my patients wanted to call it the Miracle device, the Save My Life device, and I couldn't do that. And the best we could come up with as far as giving it a name was just to call it the Urbanic device and protocol. And today we're going to discuss the 15 reasons why you should consider using this device and protocol. Up until this time, up until this specific episode, which I believe is episode number 82, possibly 83, on Dental Town, was pretty much generic in nature, educational in nature, and this will be educational also. But because of the specifics of our device and protocol and the company that holds the patent rights on this device, it has to be, I have to talk more specifically. And I do understand that these podcasts are not necessarily, and the episodes are not necessarily designed to promote a particular product. And I have not done so. I've tried my very best to educate you, the person who has the opportunity to actually solve this problem in your practice, just to educate you as to what is really going on with TMD. But today we're going to talk at times intermittently, just mention the Urbanic device and protocol, because what we have to offer is very unique, extremely unique. First of all, it's unique because it really works. I'll let you decide that for yourself at any point in time. And I will also say right here at the beginning, I really welcome criticism or comments or suggestions about additional topics, new topics that you'd like covered regarding TMD. I cannot say that I have researched and know everything about this problem for sure, but I've definitely researched it from a different point of view, which actually solved the problem because we understand what the cause is and the relationship of the cause to the symptoms. Not the nonsense about using Botox to paralyze muscles or various devices used to diagnose TMD, because it's all related to inflammation. It's irrelevant what kind of device you use to measure muscle function or dysfunction or the position of the disc it is all irrelevant. It's all about inflammation. But let's get started on this particular topic for this particular day. And I find this very interesting. I hope you do too. And we're going to list these out and talk about them briefly. I hope I'm not wasting your time. This is important. This is critical for many reasons. There's a synergy. There is a huge synergy, which I did not create intentionally. I did not create it at all. There just happens to be a huge synergy regarding solving this problem for the benefit of the patient and the provider, the doctor, the dentist, that creates all kind of good things. It's a win-win situation, win-win synergy, and of course, a win synergy for our company, TMJ Services. So number one, why dentists should want to treat TMD with the Urbanic device and protocol. Number one, actually, we have actually solved the problem for the patient. This is a big statement. I won't elaborate much on it, except that we now have an independent study through Middle Tennessee State University based on 3,000 of our earlier successful cases that were done between roughly began 7 years ago. So that would be about 2016. And over that period of time, we between then and 2020, 2019, I believe, we accumulated 3,000 successful cases, at which point those cases were turned over to Middle Tennessee State University independently and said, here's 3,000 cases. Please do a study on these patients, interview them. They did a survey study on the patients independently to see what the patients thought of the service and the device and how well it worked. And that material is available. That study is available. All you have to do is contact us. We'll be happy to send it to you. I won't elaborate. It's a study that goes into every detail of all the symptoms and specifies what percentage of those symptoms are diminished for each symptom over a period of time, and that the overall success rate based on the patient's statements is 85%. So it actually says we have solved the problem based on what the real cause is. Starting what the real cause is inflammation in the temporomandibular joint, not the position of the disc or anything else, or the type of occlusion that they have. Number two, solving this problem is excellent PR for the practices. And this is where the synergy begins. Each of you, if you are in private practice, and I assume most of you are, although there's maybe some academicians viewing these episodes, which I encourage for sure. But most of you are private practitioners, and nothing is more beneficial than having good PR for your practice. And I can promise you, and this will come out in several of the other benefits that we're going to talk about, that when you actually solve this for a patient, it is excellent PR. It spreads rather rapidly when the patients and that's the majority of the patients who have had these symptoms of TMD, headache, earache, jaw pain, neck pains, tinnitus, subjective hearing loss, vertigo, upper back and upper shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking. When those symptoms are solved for a patient that has carried those symptoms for a long time, 5, 10, 15, 20, 30 years or longer, and most of our patients have those symptoms for a long time before they ever end up in our practice, it is excellent PR for your practice and all the benefits that good PR brings. Number three, it generates more referrals. Kind of an extension of number two. When those patients find relief and they see that it's long-term, They want to send you all of their family, all of their friends. They speak of you very highly, and it generates more referrals into your office for those symptoms, TMD/TMJ, and other services. We'll talk about that. We'll talk about that more in just a moment. Number 4, patients, if they come from a different practice, let's just say, well, in our situation here in Middle Tennessee, roughly half of the patients who were referred in for TMD services, non-surgical TMD services, half come through the dental community, dental professions, and half through the medical professions. Medical professions being PCPs, general practitioners, walk-in clinics, nurse practitioners, physician's assistants, ENTs, neurologists, who are now become enlightened to send patients in to see us, and the dental, my dental colleagues who are all over the board, from general dentistry to my oral and maxillofacial surgery colleagues, to orthodontists and periodontists and endodontists who send us patients who they bump into these patients. And once you treat that patient successfully, if they come from another provider or don't have a provider, they want you to be their dentist. You have proven to them that you know what you do, you know what you're doing. You stand head and shoulders above many others because they have gone to multiple practitioners most of the time. By the time they get to see you, you have solved the problem for you, and they look up and they go, I want you to be my dentist. When they look up at me and do that, and I've said this several times in different episodes, I just have to kind of smile, laugh, giggle, say, no, ma'am, you do not want me to be your dentist. I have not held a dental drill, as opposed to a surgical drill, a dental drill, in literally 50 years. And that gives us an opportunity then to refer those patients out to general dentists who have those skills that I don't have. General dental skills. If I ever had them, I don't have them now. And number 5, allows you to become the expert. You will become the expert on this problem. No doubt about it. It will not take long. Whether your community is in a large city and you have a geographic area that you service, or whether you're out in the country and you have a much larger geographic area that you service, the word will get around rapidly, and your geographic area that you service for this particular problem will expand significantly. So if you're looking to expand your geographic area, this is an excellent way to do it, because you will become the expert on this, and your name will come to the top of the list. It isn't forced to the top of the list. It literally, you really don't have to force the issue at all. As my mentor at Vanderbilt, Dr. David Hall, frequently said, the cream floats to the top. You don't have to push it to the top, and you'll become the expert. And I'm not sure how important that is to you, but it has significant value, and you'll become the expert on treating TMD and go way and beyond others who do it or try to do it, including the surgeons who, as a maxillofacial surgeon, I'll fully admit there aren't many oral and maxillofacial surgeons who even want anything to do with TMD anymore. So you will surpass any surgical interventions by far, using a very simple non-surgical intervention and protocol, the Urbanic device. Number 6, using the marketing program to become a part of the medical establishment. Now, I got a little ahead of myself. We have developed an extremely successful marketing ploy or mechanism, whatever you want to call it, which I'll explain in a minute. Again, we have explained it in other episodes. But as a dentist, your interface with the medical community has been very limited from the onset of your training in dental school up through whatever you do and whatever kind of community you have. Other than social interface with your medical colleagues, the professional interface with the medical colleagues is, as I know, I'm certain, has been extremely limited. And if a medical doctor or nurse practitioner or physician's assistant seems to think, for whatever reason, that the patient might need a dental service, they say, well, go see your dentist. They say, go see your dentist. They don't have a particular dentist they want to send them to. And that is where getting involved with your Urbanic device and protocol far outshines and succeeds in getting you to be an integral part of the medical community, because you will start getting referrals and you will start getting comments from the medical community. Like I had one just yesterday, and the patient themselves shared with me that a medical doctor who I did not know, her comment to me was, my medical doctor, who happened to be an ENT, said, hey, I heard that there was a doctor in Brentwood who really knew how to treat TMD. And that's where she ended up in our office, and I did a consultation with her yesterday. So, but it stands firm that it would behoove you, it would be helpful to you in your practice to gain and garner a significant interface with your medical colleagues in your community, large and small. And that is a significant benefit, which derives primarily from the marketing mechanisms that we use to enlighten the medical community and parts of the dental community as to how well the patients are served by using this device and protocol. We'll talk about it in a minute. I'll leave it for your imagination right now. Number 7, you can become a hero. I don't know whether that's important at all, but if you'd like to be a hero, you like hero movies, well, actually in your profession, the dental profession, you will become a hero to these patients. And they use that word not infrequently once you treat them, once you get them out of their conundrum of years and years of painful symptoms or dysfunctional problems with their hearing or their vertigo. You really become their hero. And again, it gets into the PR, it gets into spreading, becoming an expert, the synergy involved that I tried to explain as we begin speaking. Number 8, very important. And that is, the device and protocol is a medical device. It is not a dental device. It's patented as a medical device. When I did literally 30 years of temporomandibular joint surgery, if it was covered, and almost it was, almost always, I can't remember a case that wasn't covered that we did surgery on the temporomandibular joints. It was always covered under medical insurance. It was not, dental insurance does not cover surgery on the temporomandibular joint. Therefore, if you do a non-surgical treatment for the temporomandibular joint, don't let the medical insurance try to tell you that it's dental, and it's a medical device that has no CPT code, and therefore there is no insurance control over this. And there's a longer story that I think I've shared earlier, but we'll just leave it at that. There is no insurance control. This is a fee-for-service medical service that is not covered under dental, and it is not covered under medical. It is a non-surgical device not covered with CPT codes or on the medical insurance. So it's a fee-for-service. And there is not, I don't think there's a dental practitioner out there who is not looking for some kind of fee-for-service that is beneficial to his patients, that will enhance his financial aspect of his practice. And this is certainly one of those services. The average fee for, we looked into this extensively, the average fee for non-surgical TMD services coast to coast varies between $2,000 and $3,000. So I just leave that up to you to figure out how that might enhance your practice. We talked, number 9, talked a little bit about this. It's a practice builder if you want more patients. If you want to have so many patients that you need an associate, if you want to expand into larger quarters, but you need more revenue and things that go with more revenue, then this is a huge practice builder. It allows you to do that. Which goes along with number 10, increased, I was just about ready to mention, increased income substantially. The doctors who are now using our marketing mechanisms are doing extremely well. The leader here for the past year just added $200,000 to his revenue for the year, which is substantial for any practice or for a practitioner, provider. And it's going up from there. He's just beginning to get traction using our marketing method to primarily the physician, the medical establishment. Number 11, it's easy to treat. One of the reasons that is justifications for not treating TMD, they think it's really complicated. Well, it is not complicated. That is explained thoroughly in other episodes on this podcast. I'm not going to go deeply into this. We're just listing out the reasons you should, and one of them is it is easy to treat. The consultation itself, once you understand what you're treating, why you're treating it, why the symptoms diminish, how to interface with the patient. Once you learn all this and do it a few times, total time devoted to treating a patient, start to finish, and I mean consultation, interview, delivery of the device, follow-up checks that can go on for 4 to 6 months after. So you'll see the patient total 4 to 6 times usually, a lot of times less, because a lot of times once the patient feels they are at the place they want to be, they will not come back to the office. You can't get them back. You can't beg them to come back. They just don't want to come back because they think they're totally fixed, which they are, but you can't follow them up, which is unfortunate, because we want to make sure that we document each and every patient to the full resolution of all of their symptoms to come in with. But it's easy to treat. It takes start to finish 45 minutes, and the whole process is, very simple. Once you make the diagnosis, certain of the diagnosis goes through the diagnostic, history and physical examination. Number 12, it's very predictable, very, very predictable. Again, we touched on the independent statistical study done through Middle Tennessee State University that shows patients' satisfaction, which is up to 85% of their symptoms are diminished or gone on across the board, over 3,000 patients. Again, I have to note, nothing is perfect, and I am going to do an episode here in the very near future on patients who we do not get, and they're a very small percentage, the expectations that we expect, and there's reasons for that. And actually having done consultations now for this service well over 6,000 times, I know what we're dealing with and why a small percentage of patients do not get the response, and when they don't get it, what we do about it, actually how we handle that and why that occurs. And I'm going to do an episode in the future on that issue, but this is very predictable. You literally can predict exactly how it's going to go, although every patient is different. I've never seen 2 patients go through the process identically, although there's tremendous similarities, but no 2 patients are identical, and you have to be ready for that. Number 13, why you should do this. You have tremendous clinical support, and that touches on it touches on number 12, which is predictable. If you have a clinical problem, if you see any kind of issue with the device itself, the fitting of the device, or how it needs to be situated, or how it addresses the occlusion, or how it is effective or if you're having problems with the effectiveness of it, you have total and complete clinical support from our company. I mean, literally, we have a mandate, that you can communicate with us at any time about any problem, about any reason. And it will always be that way. Once you catch on how this works, there won't be a necessity for a whole lot of that kind of communication, but it is open, and that you have total clinical support, as opposed, and I will leave them unnamed, as to other kinds of oral devices that have been proposed or used to treat TMD. And you take the course, or you have the concept, or you read the journal or whatever, and you use the device. Well, you're on your own. There's nobody to call. I don't think that's good. And then when it doesn't work, then what do? Well, you're left scratching your head. So we have tremendous amount of expertise and experience using this device and protocol. I can't say that I could answer every detailed question off the top of my head, but I think that I've seen it all after treating thousands and thousands of patients with this, along with my associate, and now getting experience from a growing number of network providers who are also going through the experience of actually beginning to see, as they increase the volume of their patients and increase their revenue, they get to see what I got to see beginning many years ago using the device and protocol. Number 14, the company's marketing support. So now we'll get to a brief description of that marketing ploy or marketing design that actually drives in huge numbers of patients. I've talked on it before, but this is a huge reason you should be using the device and protocol, because it works, because all of the other reasons before, but you can actually take control. You will control the inflow of these patients into your office. If you feel you don't want to do an extra 20 consults a week, which we do around here, you can tone it down. You don't have to market it as much, but if you want to increase your revenue and you increase the patients and all the benefits of doing it, you have total control by using the marketing support that we have. And the marketing mechanism is quite simple. I'll explain it briefly again. And we do the majority of it for you. We drive the patients into your practice. You do have to collect a little data and pass it on. You have to collect a little data and pass it on to us, but we do the marketing steps that drive those patients into your practice. So you don't have to be a marketer. You don't have to do anything other than follow the directions and collect a little data. Basically, it's all about, first of all, collecting the number of providers, any kind of provider, dental provider, medical provider, chiropractor, massage therapist, who that particular patient shows up at the front desk. We collect the names of all those doctors, especially those that have been seen for one or more of the symptoms that the patient comes in with TMD, or any other provider, even though they have not been providers for those particular symptoms. We collect all of the provider names that patient can recall. If they only know where the practice was, we look it up, and we will then follow up with those doctors. Every time the patient comes back for a service, whether it be their consultation, initial consultation, or the delivery of the device, or follow-up checks, which are routine at 3 weeks after delivery, at 2 months after delivery, at 4 months after delivery, and 6 months after delivery. That's the routine. That is the protocol. A letter is literally, a snail mail letter is produced, which says the following: your patient was in our office today, give the patient's name, and states, and if it's just a consultation, it's for a consultation or the delivery of the device. But the most impressive letters that impress upon those doctors that they end up with is: your patient, Miss Jones, was in our office at 3 weeks after delivery of device and states her subjective statement today is 70% of her symptoms are gone. And those symptoms are mentioned, are named. Ms. Jones was in our office today. By that time, the doctor had received 2 prior letters that said your patient was in today and had a consultation, is getting the device. Then they get a letter, the device was delivered, and they get a letter that at 3 weeks, a certain percentage of those particular symptoms, let's just say headache, jaw pain, and neck pain. And the patient says 70% of those symptoms are diminished or gone. And as the patient decreases the symptoms, those letters continue to go out to all of the doctors. The greatest list of doctors I have seen so far in our practice has been 15 doctors per patient. And it can vary between 1 and 3 or 4. 15 was the greatest number. And then when the patient claims their subjective statement that 85+% of their symptoms are diminished or gone, an additional letter goes out to all of those providers stating your prior patient, Ms. Jones, was in today, and by her subjective statement, these symptoms are 85% plus, it's 90, 100%, whatever it is, resolved. And a success story, which the patients almost always are happy to give us, is included with that letter, along with a picture of the provider doctor, which would be me or my associate. And that system, hopefully you follow that along, it's quite simple. That system has generated here for this practice 700 at this point in time, a list of 768 individual referral professionals who refer TMD patients to our practice. And that can happen to any of you who are listening to this over a period of time. It's a snowball effect. I've mentioned that before. It doesn't happen overnight, but it's a snowball effect. And all you have to do is collect the information at the front desk. And every time the patient comes back to see you at delivery, at consultation, and every check appointment, what the patient states about her or his symptoms, what percentage of those symptoms are diminished or gone, not how much better they are, but what percentage of these symptoms are diminished or gone. That's all the information we need, and we do all those marketing letters and keep track of it for you and drive huge numbers of patients into your office that you have not seen ever before, and create for you an increasing number of referral sources from doctors you have never heard from before. You don't even know them, don't even have to know them. They will continue to refer you patients for temporomandibular joint services every time they see a patient with this problem, and you have the opportunity to educate those doctors into that those symptoms are now properly diagnosed and not misdiagnosed. It's a huge benefit, huge benefit. And number 15, the opportunity to market a new service to your own patients. So we are trying to educate our current network providers and additional network providers that use our patented licensed urbanic device and protocol. We encourage our network providers to market it within their own practice, primarily through their hygienists. I mean, of course, the doctor can talk to the patient, get a history. Well, you have chronic migraine headaches, as they say in the South. Well, that may be a migraine headache, or it may be actually inflammation in the joint causing bad headaches. And that's what we see mostly around here. We treat bad headaches that have been misdiagnosed as migraine headaches thousands of times. But basically, you can market that internally if you just teach your hygienists to take a good history and ask the right questions. Do you have a history of headaches, jaw pain, neck pain, shoulder pain, ringing fullness or dizziness? That would set off the ability of you, the professional provider, to do a little exam And you may, again, be the hero for your own patients who you are not even aware that their migraines or their neck pain that they are now they're considering neck surgery for, which is actually coming from inflammation within the temporomandibular joint, and avoid taking medications for their, quote, migraines, or eventually ending up with neck surgery that, quite frankly, was not necessary. We see quite a bit of both of those, especially patients medicated for migraines that don't have migraines. Their headaches are coming from inflammation of the temporomandibular joint. That was kind of long-winded, I think, but I think it was specific, and I hope that it was impinging on you to understand why you should treat TMD. Many reasons, many good reasons, and there's a tremendous amount of synergy involved with treating TMD, synergetic resolution and information and benefit for the patient, for sure, number one, the provider, number two, and synergetic, of course, for company and actually for healthcare in general. We are on a mission to solve TMD nationally, internationally. It turned out not to be a real complicated problem. I hope I've explained that enough where you begin doing the investigation for yourself and finding out for yourself. If you'd like to learn more about what we do, if you'd like to become a network provider, you can contact me at tony@tmjservices.net. You can contact our Director of Education and Marketing, Naomi, at tmjservices.net. If you want to see exactly more information, what it's more about, our website, www.tmjservices.net. As I stated earlier, we are open for communication at any time for any reason. I look forward to it. And again, I encourage comments and criticisms. I'd like to see more comment and criticism if you want to. No problem with me. I'll be happy to respond to anyone who communicates with me at any time. For today, we'll wrap it up. I look forward to our next episode, which will be published every Thursday on Dental Town. I am Tony Urbanic, and this is TMD Demystified.